Okay, this is going to be a very short talk on small colon impactions. So small colon passes across the caudal abdomen, and it is responsible for removing water and creating the fecal balls. In this picture, it's D to C, so it's easily palpable per rectum, and it should feel saculated and have fecal balls in it. So they can be similar to ovaries, or ovaries can be similar to fecal balls, and you don't want to get the two mixed up, but it will feel quite different from the pelvic flexure in most cases when it's normal. Animals that are more highly affected by small colon impactions include ponies, mares, older horses, and brood mares in their last trimester. A lot of this has to do, we also do see it a lot in miniature horses, and that's not listed there. These animals tend to be able to pull more liquid out of the manure, so the fecal balls become drier and firmer and become more impacted. Predisposing factors include poor quality roughage, a low roughage diet, poor chewing of the diet, poor, painful teeth or no teeth, decreased water intake that would lead to more dehydration, lack of exercise, probably leads to less motility, and parasites. So looking through this, I want you to think about what other type of colic would have similar predisposing tendencies. It would be a top differential. Clinical signs include just signs of mild colic. Horses tend to be more often dull and anorexic, not passing as much manure. They may actually have diarrhea. They may be bloated, abdominal distension. These horses can have fever, and I've seen a few of these reflux, although it seems an awful long way to the stomach. Rectal palpation. Instead of feeling the fecal balls, you'll actually feel a solid tube of manure about the same size as a large fecal ball, extending for up to several feet. These horses are more prone to getting diarrhea, and these tend to be associated with salmonella. So this is a big prognostic factor for these animals. We don't know whether the salmonella is the original problem and leads to a change in motility that leads to the impaction, or because these impactions affect the small colon where there tends to be more salmonella that naturally live there, that the change in motility and other factors lead to more salmonellosis. So prognosis tends to be good as long as these are treated effectively and they don't break with salmonellosis. So referral is recommended because these cases can become complex pretty quickly. Oral fluids are best. IV fluids tend to not make it down to the small colon. Oral fluids are best for most types of impactions. Think about it, if you put a horse on IV fluids, they're not defecating every 15 minutes, they're urinating every 15 minutes. So a lot of those very expensive fluids get peed out of the horse instead of helping with the impaction. So this horse has a full stomach tube placed down into its stomach, and we can drip water into that, regular tap water, instead of expensive sterile IV fluids. So I want you to think about distending the stomach really helps these guys, and what reflux that is that helps move this impaction through stomach distension. And kind of in reverse, as I said, some of these will reflux, and that can be very frustrating because that means you can't use your oral fluids if they're just refluxing it back out again. I don't know whether these horses just tend to be wussy in the first place and that's why they develop a small colon impaction, or if these are more painful than other forms of impaction. But some of these horses will be very resistant to pain management and will actually go to surgery based upon the level of pain. We do try to give them laxatives such as mineral oil and can very, very carefully give them some gentle enemas. We tend to wait and do the enemas at surgery to get to the affective area, and it's safer that way because we can monitor where that tube is going and not creating any rectal tears. So as I said, some of these will go to surgery, where you massage the impaction loose, inject a lubricant into it, and then do an enterotomy to minimize the load on that poor bruised area of the colon. Prevention is good water intake, a good forage diet that they're able to chew well because of good dental care.